Scientific literature. Can you see? Prevalence of serious eye disease and visual impairment in a North London population. Population-based, cross-sectional study. Objectives: to estimate the magnitude of serious eye disorders and of visual impairment in a defined elderly population of a typical metropolitan area in England, and to assess the frequency they were in touch with or known to the eye care services. Conclusions: untreated visual impairment and eye disorders affect a substantial proportion of people aged 65 years and older. These findings should contribute to the setting up of future strategies for preservation of sight and eye health services in general. Discussion: visual acuity was assessed with the person wearing his or her spectacles, so that the day-to-day vision, rather than the potential best possible vision, was measured. This allowed prevalence estimates that reflect the actual visual impairment problem existing at the time of the survey. Recent studies, such as the Baltimore Eye Survey, the US Salisbury Eye Evaluation Study, and the Blue Mountain Eye Study, have reported the visual acuity after refraction and best correction at the time of the survey. Major difficulties in comparing results from different surveys arise from non-standardized definitions, criteria, and examination methods. Glaucoma is particularly problematic as there is no generally agreed definition for it. The criteria used in our study to define a case of primary open-angle glaucoma were clearly defined and set at a higher severity of optic disc damage than those used in several earlier studies, and were similar to those in a much-cited Australian study. Detailed comparison of our findings with other studies, therefore, would not be fruitful. In spite of the stringent criteria, the prevalence of glaucoma was substantial, and the number of people who should be monitored as suspects considerable. Our study used a cutoff for visual acuity of 6/12 to define visual impairment. This is in line with the cutoff used in the Baltimore Eye Survey and with the minimum legal requirement for driving. Using the 6/12 cutoff for visual acuity should allow health agencies to be alerted to the full spectrum of clinically important visual impairment in the population. Of the 448 people found to have impaired vision in both eyes, the visual acuity in the worst affected eye was within the limits, less than 6/12 to 6/18 in 19%, less than 6/18 to 6/60 in 61%, and less than 60/60 blindness in the remaining 21%. The distribution is thus skewed towards more severe visual impairment. Of the 451 patients with visually impairing cataract, 310, 69%, had a visual acuity of less than 6/18, with 51, 11%, being blind, visual acuity less than 6/60, from cataract in one or both eyes. Most of this morbidity was not known to the eye services. Several factors could be responsible for the high level of undetected and untreated morbidity in the population. These are, firstly, inadequate levels of attendance at the high street optometrist or failure to purchase corrective spectacles. Secondly, suboptimal integration of vision checks into the general primary care of elderly people, possibly linked with a reluctance to add to the lengthy waiting lists. And thirdly, patients' perspectives on the extent to which their vision has gradually diminished, the point at which help should be sought, and uncertainties about the treatment and the outcome. We have recently completed a follow-up study of the survey cohort, which should help us to identify and to quantify some of the deficits in the pathway to care for people with impaired vision.